Dear patients, especially my female patients, we need to talk. A 26 years old patient walked into our unit and during consultation, she complained of sudden blood vision that's been occurring since 3 weeks. And according to her, this sudden blood vision occurs only in the morning and disappears few minutes after she woke up. Then on Sunday, it occurred again, and at this time, it took longer time for her vision to restore. So that got her scared. That was why she came to the hospital on Monday. And when she said this, I asked her, did anything hit your eyes? Have you been ill? She said, no, nothing is wrong with her, that she's fine, except this eye now that is doing like this. I said, but not on any medication at all. She said that just a small drug that she takes just to eat well. So and I asked her, why are you taking a drug to eat well? Have you not been eating well? She said, not really. She's just taking it just to improve her appetite. And we know that when a woman is concerned about how she's eating, we are looking at a woman that desperately wants to gain weight or lose weight. So when she said that, and I looked at her, she's not fat. So I asked her, do you remember the name of this particular small drug you are taking to eat well? She said, no, really, Dex. Immediately she said Dex. I cut her short. I said, is it dexamethasone? She said, yes, I think you're right, doc. After seeing her, I discovered her eye pressure was high. That's not even the bone of contention. The bone of contention is that we in this country, we like self-medication. And as we are doing this self-medication, we don't even make effort to read the leaflet from these drugs that we are taking. Each of these drugs produced that you buy either from market, from chemists, from pharmacy, they have leaflets. And the reason why this company put this leaflet is not for fancy or to give you work or assignment to read. They are giving you information about these drugs, but you people only have strength to go to the chemist shop to buy it, but you don't have strength to read this leaflet. That is where you will see the reason why these drugs were produced in the first place, what is used to treat, contraindication, that is people that are not supposed to take it. Somebody said it worked for me, you can buy it. And this is common in women. Women abuse these drugs so much, especially when they want to gain weight. But the sad thing is that these drugs are being prescribed only by healthcare workers. Let me tell you people something you don't know about these drugs. For those of you that take it to gain weight, if it's being prescribed to you by a doctor, fine, because I know these doctors will watch you closely. But when you're doing self-medication, it is very wrong. You see this particular product, this company, this Mayer's company, they are very, apart from this, they produce other multivitamins that are very good. But you see this particular one, this drug has what we call anticholinergic effects. Leave the gram, I'm going to break it down. Now, what does this anticholinergic effect does? You know that in our body, we have the parasympathetic and the sympathetic nervous system, right? Now, the parasympathetic nervous system, which we know is responsible for digestion and rest, as well as conservation of energy. This parasympathetic nervous system also play an important role in your eyes. It releases what we call acetylcholine. This acetylcholine in your eyes helps to reduce the size of your pupil, especially when you're under the sun, in order to prevent too much light or sun rays entering your eyes. Now, what this one does is that it blocks this natural phenomenon. So when you drink this drug, first of all, your eyes will open. That's your pupil. It acts by increasing the size of your pupil. Now, where the problem is, when the size of your pupil is increased more than normal, it can push that colored part of your eyes, called the iris, it can push it forward. And when this happens, it can block the trabecular meshwork, the channel through which the fluid in your eyes that regulates your eye pressure flows out. When the trabecular meshwork is blocked, it can increase your eye pressure. And this is contraindicated for glaucoma patients. The owner and producer of this drug, they wrote it there in their leaflet, that this drug is contraindicated for glaucoma patients, especially angle closure glaucoma. For those of you that have undiagnosed glaucoma, those of you that are glaucoma patients, please, you need to stop taking these drugs because it can worsen your glaucoma. The other set of people I need to address are those ones that sleep and wake up with this DEXA. You see this DEXA? Run away from it. This one now, if you don't have glaucoma, you can take your drug, especially if it was prescribed to you by a doctor, you can take it. But then, you see this one worsens glaucoma, this one causes glaucoma. Can you see the difference? This is called dexamethasone. This drug is a pure steroid. It works by causing fluid retention. Now, how does it cause glaucoma? when you are taking this drug, when you continue abusing it, because it causes fluid retention, it also causes deposition of other extracellular matters, which include glycosaminoglycans, collagen, laminin, and hyaluronic acid. These extracellular matters, do you know what they do? They can block the channel, that's the trabecular meshwork, through which the fluid in your eyes, the aqueous film, goes out. It can block it, and when this happens, it will hike your eye pressure. And when your eye pressure is high, it can start damaging the optic nerve in your eyes. That is the nerve that transmits visual information from your retina to your brain. And the end product is usually glaucoma. Maybe you don't even have history of glaucoma in your family, or you are not even supposed to have glaucoma in the first place. But when you are abusing this one will give you glaucoma, like free of charge. Like this Deza, you need to completely run away from Deza. Anything Deza does not even make you to gain weight. What it does is that it causes fluid retention, fluid waste products that you are supposed to remove from your body. It will cause your body to hold it instead of your body to release all these waste products and flush it out from your. It will cause your body to hold it and keep it. That thing is causing is not even fat. It is just making you to swell. You see your leg will start swelling. You think you are fat. It's not fatting. No, you are not fatting. You are swelling. Apart from that, this drug causes glaucoma. This drug can cause kidney problems, steroid-induced cataract. It can cause other systemic disease. You might not even have money to treat.